Good afternoon, everyone. My name is Marko Maver. I was introduced as an environmental policy expert. My background is in environmental science, policy, and law. I think today we've heard a lot of this interplay between the science, policy, law, and I think it's important. This panel brings some of the issues that have already been raised today together for us to discuss and see how pollutants and what impacts new technologies have on human health, which ultimately this is what it's all about. So thank you to all who have stayed after lunch, and thank you to all the panelists who are here and also joining us online. I would like to start perhaps first with some initial questions to each of the panelists, and then go into more of a debate between the panelists. And then at the end, if we have any questions from the audience, you're more than welcome to ask. I would maybe ask first question to Miss Asami from Japan.
When was the first time you personally questioned whether tap water was safe to drink?
Sure. Yeah, I can definitely say I would be assured in the water quality, and it is checked and now well managed. So people sometimes worry about the safety, but usually under the 99% it's safe. But only sometimes they have some problems, but we usually say yes. And we have to be very careful to communicate in the vessel communication in Ichi.
And we know before today also, because the second question is also to you, that chemicals and microorganisms are present in our environment, in the food, the water we drink. So in essence, we're continuously being exposed to certain levels of risks. We know technologies to extent reduce this risk, but in your view, what role does communication about these risks play in doing so, and how does your institute approach this?
Actually, Japanese government is doing risk assessment and risk management in different agencies. So now I moved to the National Institute of Environmental Studies, but we have research programs, and also we have a food safety committee which evaluates the toxicity. So in between the communication, we use the risk assessment, and as a result of risk assessment is used for the risk management. So in this figure, I very briefly introduced the problems that PFAS and could you continue? Yeah. PFAS and solvents, pesticides and anti-resistant bacteria and so on are people's concern. But we are managing the quality very low level, so usually it is very safe. But in this case, we have to make a good risk communication between the people and also the government and the scientists. So it is very important to have this kind of open discussion. Thank you very much.
Check your mic. Mr. Gonzalo, my question is, perhaps could you tell us when was the last time you reached for a bottle of water instead of drinking from the tap? Apart from today's event where we've all drank from bottled water. Okay.
Thank you. I would like to share with you one anecdote which happened in Spain during the Cold War in the late 60s. The U.S. Army dropped by the stake a nuclear bomb into the ocean, close to Almeria. Spain lives for the tourists. More than 15 of the GDP came from tourists. It's the same in Brazil, Argentina, and too many countries in Latin America. What happened? After the bomb was dropped into the ocean, nobody wanted to swim into the sea. So Spain ran out of tourists. Our economy was dropped. So the Minister of Health and Zurich decided to swim in the sea to show that the water was safe. The same bit the President of Spain and the whole cabinet appeared. This is called Efecto Palomares, because Palomares was the surname of the minister. Nowadays, in Latin America, we use this learning to show the population that our water is safe, will adapt around the quality arose. We started drinking water from the tap or from the bottle to give confidence and trust to the consumers. This happened often in our region. It is the case of Brazil, for instance, in Florianópolis, in the southeast of the country, which every summer diarrhea outbreak affects the tourism, the healthcare services, etc. So every summer we deal with this issue, and the first step to solve or to overcome this complication is to do surveillance, to implement epidemiology, labs awareness in the water system, not only in tap water, but in bottled water and in recreated water, in the sea, in lakes, etc. So the first thing that we should do as leaders in water is to open the data to show our citizens which is the quality of the water in real time. This is one of the technologies that we use to make our water trustable. As I mentioned in the last panel, a couple of weeks ago, we found typhoid fever in more than 100 people in one of the neighborhood of Buenos Aires. It was amazing and sad at the same time because it was a novel disease that we had not seen for decades. But the thing is that our water is changing every time. The quality that we had yesterday is not the same that we have today or tomorrow. So the other concept that we have to take into mind is that we got a lot of new pollutants in water that we did in the past. As Alistair said, talking about the Sunshine River, out of 45 contaminants or pollutants, the rest of them are not included in the reactor or in the relations that we have nowadays. So the second learning from contamination and pollutants is that we have to broaden our regulation, including new pollutants that are affecting our health, as you know, microplastics, PFAS, heavy metals. It is not easy, and I will tell you why, because our population is afraid of arsenic, nitrates, and mercury. If we ask every family in Latin America if they are concerned about water quality, they are going to talk about these three pollutants: arsenic, nitrates, and mercury. And why? There is a reason. The thing is that nitrate affects newborn babies. And for the media, for the government, it's shocking to see a baby becoming blue, the name of the disease. If you have seen a baby become blue, the skin totally blue, is really a sad and catastrophic image. So we have a trial which is called Caso Mendoza, in which a family accused the government not to do its best to avoid nitrates in water. So the whole population nowadays is worried about this kind of contaminant pollutant. But if we don't teach population that they want to be careful regarding microplastic, illegal drugs, benzodiazepines, and others, new contaminants or merchant pollutants. We have not achieved our goal, which is working together with the population. I think this is our best learnings from the past.
Thank you. That's very substantive answer. As you connect things really well in the what's key in ensuring the populations drink good water is transparency, the responsibility from decisions from the authorities, and then accountability as well.
But I forgot to talk about the historian. In our case, in Latin America, reverse osmosis, biotechnology regarding membranes, we have technology available. The thing is that most of water utilities in government can afford these technologies.
And we came across when I was preparing for this conference that the Argentinian Chamber of Water conducted a study on public perception, concerns, and behaviors. I think it was in 2024. And it was found that most Argentinians, of course, are concerned about the qualities of water. And I think it was 64% viewed it as a critical factor when deciding where to live. Even more recognize different regional disparities in water availability. But what's surprising to me was that 88% are concerned about industry's use of water. Yeah. So really based on these findings, just a quick response we'll get into the debates there. How should industry proactively address pollution and enhance the trust in water systems?
Well, most of the companies, middle size, not the largest, don't have any treatment system for wastewater. So they need to be convinced to invest in technology. And beyond that, I think banks or funding organizations should lend money to them to be able to afford this kind of technology because they are really expensive. And I think the earnings of the companies nowadays doesn't allow them to invest in technology.
Thank you. And maybe this question is then to Mr. Trijanets. We've heard from Gonzalo that data and transparency is key to learning about what pollutants we have and then obviously implement solutions to address them. Have you ever in professional personal capacity you received results from a water test that surprised you? He's the big answer.
Yes, of course. Thank you very much for inviting me. Yes, because I work in a laboratory. I was about 10 years old, so analytical chemist. Very well also this analytical chemistry. I remember also the cases, but in Slovenia, I not say these were only occasional or accident cases, yes. But in general, if I see Slovenia, this water supply, water monitoring, water control is very well, and also quality in the water is very well. But of course, there are some applications in some cases, some hotspots, some special occasions like weekends or concerts and so on.
Tell us also a little bit about the cocktail effect that we've heard. Obviously, we have different pollutants going about, and what is perhaps how has monitoring from a technological perspective evolved over the last couple of years, or what is, let's say, the next big test?
You talk about, and then a lot today, and we know that there is more and more new chemicals. Of course, technology is going also very well on with analytical approach. We have good instruments, very possibility to attract all practically all the chemicals, but I cannot take only one instrument or one method to catch all the chemicals, substances, and so on. And of course, it's very important also from an analytical point of view, from other point of view, the concentration. Actually, you will find almost every chemical in water or environment if you would look very near concentration. That, and you, in my mind and my knowledge, and also it's a lot of discussion and a lot of projects and research is cocktail effect. It's really something that it's, from my point of view, very big problem. How in future, when you calculate these concentrations, small and meaning bigger, you will get on the end very high concentration, if I say so. So this cocktail impact of all chemicals actually, which have the impact on human health and environment, this is, I think, very concerns about.
Thank you. And then my next question will be for Mr. Helmut.
Yeah, it's very monocle.
Any girls? Hello. Yeah. I don't.
Alright.
You can hear and see as well.
So here connection.
I saw. Well, thank you also for Maver for joining us. We've heard from this occasion it's about the cocktail effect and increasing the finding new pollutants, albeit in many minor concentrations. I read that in 2024, Pan Europe study found that 94% of EU drinking water contained the chemicals TSA. And you recently also said in one article that calls from European water suppliers, scientists, and environmentalists for a precautionary approach to pollutants that endanger groundwater have gone unanswered. Would you say that the phone is not ringing loud enough on this matter?
Yes, that's just something that you can say especially on theory. And I agree to the first speaker about cocktail effects, about the magnitude of chemicals. We live in a world with about 100,000 or nearly 100,000 registered industry chemicals, so-called man-made chemicals, and thousands of them are known environmental contaminants. Many of them you can find in water. Nevertheless, I think still this is a bold claim that I will make now. But I would bet that if you randomly take a sample water, whether it is in your home, a tank water, or in the rivers, groundwater, even in the sea or the Arctic ice, as long that I would say there's a chance by well over 90%, you will not only detect this special chemical, even maybe later talk about what it is about, this chemical, but you will also find the chemicals in higher amounts than all the other suited substances in that respective cell. Even if you have access to the most advanced analytical tools imaginable, and even if you could detect every single. So that's something that at least is suggested by all the data that we meanwhile gathered about TFA and what you now call all other known embodied contaminants. So here there is a product in question, which is in as well, if you listen to the coverage of this substance in the human water resources, because that's nearly 100%, you have to dig very, very deep to find water that does not contain TFA gas, but also in reference to the amounts that you find. So that's really exceptional. It's unprecedented, and I do not want now to say that risk from water, we do not know enough about this chemical. You know, there are some signs inherent properties that are known to be dangerous, but we do not know if the dose that is present in water poses any harm to human beings by drinking. But what we have seen is that if you look into plants, this is all living organisms are made of water. Of course, plants take water, need water to grow, and it is also found in the rainwater. It's found in the soil, and therefore it's also found in plants. And just yesterday, we had presented our newest study on GFA in cereal products. So we did look for GFA contents in bread, in noodles, pasta, in cornflakes, and in flours. And we found amounts that are on average 100 times to even 2,000 times higher than the usual background levels that you see in rain or in groundwater. And this is where we need to be, that we also have to think about risk, because we also looked into this, and we looked into the available toxicological reference values for some European countries, and there is already the first incidents to be seen with children exposed to just the average diet with European cereal products.
And did you also have a presentation, I believe? A couple of slides for us?
That's the question that's to me? Yeah, I thought now that I would not have this presentation, so I just summarize what I said. But if you like, actually share afterwards, or...
Are you well in the Nazareth, in the Cedric? Okay. Then my next question would be then for Professor Benedik. As a nutritionist, how would you compare and see nutritional value of drinks such as Prime, Gatorade to water?
It's a very good. Thank you for the invitation, especially Marko. So, regarding your question, so there's a big difference between those drinks, of course. So, those drinks which we need for our hydration purposes. So we recommend always, underline, always just water. In Slovenia, we had this opportunity to promote tap water, actually, which is available in every kindergarten and every primary schools. Regarding all other liquids, which you mentioned, so liquids which added sugar are strictly, I can say it now, if I would be the one who's making the political decisions, it would be forbidden to drink, because we know so many proofs from the literature, from the clinical trials, that sugar, which is particularly added sugar, so whenever you're adding sugar in anything, so in, for example, your coffee or tea, it's added sugar. It is clearly, it is damaging our health. It's 100% sure. And all the other drinks which are combined, let's say, with sugars or calorie-free sugars, artificial sweeteners, and then let's say caffeine and all other things, let's say chlorine and etc. The young people, they are usually love it because they kick them a ton of power, which is proven to be there. But of course, the young people would like to have this power every moment, every day, every single hour. And then this is, of course, quite problematic. We know this from several studies that is, at least and especially added sugar, we should prohibit it.
I think I would agree with you. And I previously used Prime and Gatorade as an example, is because they're very to the extreme. And we're kind of brought about, obviously, Prime is an example where then marketing and, the social media created this buzz around a drink which tastes, I hadn't tried it, so I don't know, but I've heard it doesn't taste that great, but, each to their own. But is like you said, young population is perhaps not as aware of these like long-term effects of, or let's say lower nutritional value of these drinks. I think it's
responsibilities of the governments and us as adults, as parents, to educate about different qualities and purposes of water. And I think the black water forum is an excellent example where we are not just talking about these different properties, but also entering this knowledge outside to our colleagues at work, to our children, friends, and so forth. My next question would be then to Stepan Starichev. May I ask for this? Idris?
Hello, nice regards, WebCon and Pin Online.
Thank you for being with us. I also read in the news that you recently mentioned there is a large number of chemicals in use that are not taken into account in regular or routine water quality monitoring. Which ones and why do you think that is the case?
But if you know that PFAS had about 100,000 registered chemicals, and that on a daily basis we're using approximately 10,000 different chemicals, and if we know that our regulation, especially this field of surface water monitoring, is in spilled chemical status comprised of only 4 to 5 compounds or liquid compounds, that we're using processed chemical status, it's quite obvious that we don't know everything about all compounds we are using regularly. We are exposed to every day. So while doing the water analysis with PRC and looking at is actually a picture of human society, progress in society goals, if it can be public progress. So this is why we know that regulation is not covering everything we have, what we produced, that we are using.
So you see regulation should go into expanding and including more of these chemicals into policies and then obviously into monitoring systems.
Absolutely, yes. But when we are talking about the regulation, unfortunately, regulation is always beyond the real situation in the field. And for example, now in 2025, we are prepared for this new changes or proposal changes within the water-friendly directive, the quality standards directive, groundwater directives, and now we are facing million compounds, sort of like this bisphenol example or PFAS groups. So compounds in weeks for a really very long period of time. Now, we are mentioning most of microplastic because we are about this price that we have plastic all around us. So yes, we got to improve this framework relating with the water potential. And of course, regulators, they need time, that they need additional scientific proofs, they need scientific papers, they need all additional information. On the other side, public needs to require more knowledge, more information, and sometimes it seems to me that we are, even though we do not live in an age of ignorance, that we live actually in an age of science. Because obviously, we as users, we are not on bikes. We are not informed about them. So what people try to me and admit when people change is actually that we had to count or that we need actually the users can create with accountability and regulators will protect.
Thank you. And then previous what I mentioned already before, it's about, and I think Gonzalo mentioned, use the term pollutants risk. So essentially, it's about reducing the risk. And I want to ask just a quick 1-minute answer to each of you. What is, from your perspective, what is your definition of risk? And what is, let's say, one key solution how to reduce that? And maybe start with you, Gonzalo, and then Nikita.
I would like to highlight the concept which is fit for use water. We have to understand that there is no good water or bad water. There is water for in a specific moment, a person. The risk is that situation in which you are delivering water which is not acceptable to a person in a very moment, condition. So for us, it's key to promote this cause. This can help us to avoid risk about drinking water.
But how would you define the term risk? Is it likelihood times consequence, or is it risk? Can you quantify it? Or is just risk of not receiving suitable quality of water?
Yes, we think that risk is a situation in which a person, the health of the person can be affected by the water it drinks or touch with the skin. Antonio Fingers.
Okay. That's very crazy. Thank you. We can continue.
Yes, I was just thinking what to say actually, because there are a few, let's say, territories which you can address, but the main one I think is communication and education. So we need to take care that we will not share the message or put out the message that people certainly needs to be scared of water in a way, because this is not okay. This goes into direction to drinking not so healthy options, as we mentioned before. But at the same time, we need to, to send out messages which everybody can understand. What is good for our health and why is good for our health and why we need to take care of, let's say, microplastic, PFAS, and all the other chemicals. What are those chemicals? Where are they coming from? What they are doing to our body? And of course, what are the long-term and short-term consequences for us? But maybe also to pop out not only for us, but also for our children and, let's say, grandchildren as well. Because today, as you saw in the first picture, what only micro nanoplastic might cause, causing the infertility problems, causing obesity, causing different kind of cancers, causing also cardiovascular diseases. So if we go through those points, we can address children with some information, young parents and future parents with some information, grandparents with other information. So we all here, we are together, we know what is the problem, but now we need to somehow send the message out to the, let's say, students are here as well, but, even for younger generations and future parents through the, social media, through short messages, through different kind of media available, to somehow, warn people what they need to do in order to be healthy, live longer, and have a, in general, quality life. And from the other perspective, which is also important, to somehow share the message, okay, what we need to do to prevent this in our environment, to lower, let's say, different kind of cosmetics, for example, to ban plastic things and just, throw it away. And that is important also, this recital point of view of our waste, because waste is, of course, a very problematic aspect, but we need to address people how to deal with it, because every one of here, each of one can do some small parts in order to have a better tomorrow for us and for our children as well.
Right. So essentially reducing the risk of receiving, let's say, unsuitable quality of water is education. But exactly. Hey, and Mr. Christian, it's from your perspective.
No, but what else to add here? My first thought it was, okay, the major risk from my point of view is long-term exposure, but not only from water, but in general. And what to do that we can have a healthy life. Yes, I believe, like Oleg said, is very important. Yes, education. Okay, all of us are, however, responsible for this education. That we are enough. Yeah, this is modern life, and chemicals are from this source. So this is also our responsibility with each other again to do something. It was very nice discussion with colleague at the lunch. What will be if each of us can reduce pollution for 10%? It will solve a lot of problems that we see now on the end. So this is I think the solution. We talk about risk, not to magnify risk.
Also, better or new technologies that would help us detect this. From your work at the National Laboratory, are here, I'm sure it's the largest public laboratory in Slovenia. Is there a very risk of not having the right equipments or technologies or systems in place?
Like I said, the technology is of course very well and it's going on. If you decide to analyze some chemical, we will for surely underway that how to analyze. There are also multi-analytical methods. So analytical approach is good, is getting better. But of course, it's very important in this story because we like to do this work, which is in this story. We must think about, okay, I'll say the One Health approach. This is also in our work. We are closely connected to national laboratory. We must cooperate with all institutions globally to find the problem and then to prevent environmental pollution and to keep environmental and animals and public health. This is okay. General approach is very important. It's analytical. Analytical is very important and both, but we know that it's so many chemicals, but you will find one chemical for sure. You will clarify it on some several colors. This sample, the general pollution is here. So that's very important. I'll address this one out approach.
Thank you. And Ms. Asami is still with us?
The one in the IV, can you hear me? The risk is can be calculated by science-based way based on the animal experience and the epidemiology. So we can monitor the risk and the IVD. And the second one is bottled water is not necessarily environmental friendly than piped water. So we have to ensure that the environmental friendly water access can be controlled. The third one is the measurement is very important and measured and controlled by best available technology. It is the key for the water supply and relief. So the best communication with this information can be very important to share the information. So thank you very much.
And also, Stepanichev, what is your definition of risks from your perspective, and how can we go about reducing that?
That we need to, number one, strengthen capacity of laboratory. So without an adequate equipment, there's no way that you can see more than even see in this very moment. So for example, since 2012, we have this cube of instrumentation in our lab, and this instrumentation enabled us to see much more, to see more or outside of this regulated frame of low regulated compounds. So number one, financing is important. Number two, and this is also the goal of our institutes, to spread the knowledge and to talk with the youngest minds. So we are accepting people from all kids, from kindergartens, from primary school, from high schools, university. And we always tell them, ask and read. We both written on product you are buying. Be aware that you are actually additionally also support the pollution process. So learning is important. We have to learn from history. Unfortunately, as a human society, we didn't learn a lot. So since 1962 and Silence Tree, a human society managed to repeat the same mistake but with different compounds. So then it was DDT, today it's PFAS, or we're talking about all brominated polyphenolators, or we're talking about microplastics. But we don't seem to understand as a society that we are all more to this big circle. So we have producers, we have regulators, even buyers also. So we all are the change. Each one of us is capable of changing things. Just start from your own home. Be sure that you know what you're buying. Be sure that you know what you are eating. Don't be afraid to ask. And ask your producer, because this is also important. We mean producers who create with harmfulity. So we can change the world.
I think all of us could agree with what you just said. It starts with us at home, and then we go on from there. And then also lastly to Mr. Shadi, you were named, obviously he answered, but you were named and answer a question about what your view is of first mocking them to reduce that. But you are also, I believe, named Communicator of the Year in Austria by the PR Association back in 2017. So my follow-up question to this, the first one would be, how do we translate, let's say, complex findings, or how do we communicate that that 94% of the water contains TFAs, that we have hundreds of thousands of pollutants? How do we communicate that to, let's say, our friends, to our children, to policymakers, which ultimately, we have to adapt our messages to whoever our audience is. So we cannot adopt a fear-based approach to communicating the dangers of pollutants. And sometimes that might be overwhelming. So what is your advice for us to do that?
That's really extremely difficult question, and I do have a good answer to that. I think it's what was the most complicated phase is to determine where the risk starts, where the margin of safe level ends. Yeah? And this is what risk assessment is trying to do. And risk assessment always has to fail because the question is too complex. And risk assessment always tries to convince, because the most important thing sometimes seems to be the illusion of safety more than the real safety. That's something that I experienced as an environmentalist. So regulators wants to say, yeah, we control that. But actually only two examples. We talked about PFAS and we talked about bisphenol A. I'm working on environmental complaints for decades, for 20 years meanwhile. I'm from Austrian NGO. And I was working on bisphenol A in 2029, I think. And we can criticize that the tolerated intake level by ESTA. So really that official safety margin for bisphenol A was much too high. Else, if you do much underestimating the real risk of substance, you would not be how much they meanwhile did lower. It's now lowered by a factor of 250,000 since 2008. So there was one step between, but now the 0.2 nanoburn per kilogram body weight, then it was the micro kilogram body. So that's the one thing. The other thing was PFAS. It was lowered by a factor of 2,000. So our knowledge about the risk about the inherent dangers of some chemicals and about possible risks that come from them is changed. And therefore, it's very, very difficult to say where risk starts. On the other hand, that's why I said it's so complicated. I very much agree with the before speaker who talked about sugar. Sugar provides the most dangerous prices, yeah? And this also brought me to one claim that because of it into this picture of risk. Because I could now bring a lemon bit to show that there is no risk with sugar. So also those risk communication attempts, to swim in the same to show that it's not risk, or to try to say drama, things that could happen by politicians or by chemistry consultants. I think they are also some degree, they do help us to really catch this very bad thing that is waste. So actually, I do not have a battle to that. I think it's on the one hand, of course, we should get some information to find our own decision as consumers. As consumers, we can protect us from the risk of sugar. So if we will get from our governments a concrete and precise and correct information about the risk of sugar, and this should be repeated and repeated all the time, then my children and other children and also adults who don't know it yet know, okay, I can survive to friction sugar, but this will harm my health. The settings with cigarettes. And there are other risks where I cannot protect myself. So the chemical that I was talking about that is so present in water, like no other chemical ever has been on the planet, no other synthetic man-made chemical, of course, is a PFAS chemical. Yeah? And here we cannot decide because it's everybody finds it possible chemical. That's because it's so ubiquitous. So here do we governments to act, to just stop further emissions, to help future generations not to get an even much bigger burden than we now have. So that would be my summary of this very item.
It's difficult to answer this question because obviously, as we've heard, there are different types and different perceptions of risk, and if you have something that's perceived differently by different stakeholders, it's very difficult to come to a single definition. And I think that's one thing that we should be aware of: the different stakeholders, different people perceive things differently. But that's this question to anyone of you, whoever wants to take it. Is then the solution stricter regulation? Is the solution, let's say, sugar tax? Would that fix things? Is the solution more money for monitoring equipment? I know there's no one solution, but maybe which one would you prioritize? I'll then start, sir.
I would say, and only one, more steps, maybe a little more. These actions then is not only one answer. I believe so.
Well, I agree. Sorry, please to do, let's say, step forward on different aspects. But regarding your question in the taxation, personally, I am not so keen to this taxation policy, but in practice, only this kind of way actually in a way helps that people, it is in Slovenia, if somebody will take something from your wallet, it could hurt you. And then you will start thinking, okay, maybe I need to do something or change something. So in this case, I think the taxation would be, of course, important, but if taxation will come along, and also we have laboratory equipment to detect, all those pollutions in water, but not only in water, also food we need to mention. I would just mention one thing which I was preparing to this conference. I was quite shocked that I don't know if you would believe me, but the food for animals is much more regulated than the food we are eating. So the animals are eating definitely more controlled food than we are eating it. So maybe we just need to adopt this policy to human food, and it would be one big step forward. So yeah, I think taxation, yes.
And introducing stricter regulation for as well for all the stakeholders.
I have nothing to add regarding sugar consumption. I think that which is important is to quality control in households. I think is the next steps to water utilities and companies to start watching what is happening with water inside the home, not only in the network or in the site of the production of water.
Thank you. Any other panel members online? Good about that. Roll call. Roll call up. Are there perhaps any questions from the audience to any of our panel members? Yes. Yeah.
Well, and this is good, man. I think you can ask this. In an ideal world, like diametric wars companies having very communication of the public that they said, what would this look like? Would you be like more open in regards to contaminants in the area that the utility is providing more educational resources of what this means? Or would that create more scared among the consumers? Or what role do you think water utilities, chemical manufacturers should take in informing the public about this?
Busy or
Yes, just strategy communication.
well, there is a concept that I think you have here, which is water stewardship, which is when a person or organization is engaged not only with the water supply, but the basin itself, the aquifers. Maybe in the next step in communication regarding water companies is to show in the public that there is one water, not only one health, but one water. That we have to take care of water in the streets, in the beach, in the lake, everywhere, because the cycle is only one. And at the end, we are going to clean the water that we contaminate or polluted by ourselves. I think this is key.
I think if I may add to that, we had a case in Ljubljana not too long ago, about maybe 2 months or so, where there was water contamination in a store in downtown Ljubljana, and a number of politicians and local public got ill as a result of that. Obviously, the monitoring was done. There was some communication, but I think there might have been missed opportunities to not just address the contamination of that specific, let's say, the cafe or the store, but also in the importance of the, let's say, water in general. So I think it's when it comes to, it's obvious that was an extreme case, but it's attaching different messages to events that will, I think, expedite, let's say, the messaging purpose.
Take the out. I need to have a colleague at work which is in charge of water quality in the last water utility in Argentina, who used to say, the water industry is the only one in which your raw material change every day. You never know which is the quality of the water we are going to convert in drinkable water. So the responsibility of caring of that source is of everyone, one city, village, or world.
Any other questions? Then we have a question for the audience, just by the show of hands. How many of you in, let's say, the last 3 months or so, whether you traveled in Slovenia or elsewhere, were concerned about the quality of the tap water? It's about, let's say, a third. You're gonna it's about that. Yeah. So it is in our mindset that we are concerned about it, but then do we do anything about it? Do we speak to, let's say, the hotel that we're staying at or the people that we're with in that place? I think those are also those missed opportunities about raising awareness. I think sometimes we quickly take things for granted, especially water, which is our life source. Without it, we cannot survive. But what I'm pretty sure is if it would be contaminated to the extent that we wouldn't be available to us, we would quickly realize its value. All right. Yes, there's a question.
Hi, Cynthia. There's also the other side of the question. I'm not sure if you've been to Basel in Switzerland, but they have all these fountains all over the city. And I was obviously walking around and they're so beautiful architectural pieces. And I saw people drinking from them, just going with the bottle or the cup to the fountain in the city and drinking. And I Googled, obviously, because I was like, oh my God, my kid cannot touch this water. It cannot be safe to drink. And then I Googled, and most of the water fountains around the city are with drinkable water. And they have a beautiful crystal clear water, really, really clean. And they have signs on all the fountains that is drinkable. So there's also, when traveling, just to have like a simple Google to see if we can drink the water from the tap.
I'm sure there's an app that it already exists, perhaps, on that. But I agree with you. It's the convenience and the availability of good quality water that will allow us to first drink more of it, which is obviously good for our health, and also reduce the consumption of or buying plastic water. In essence, so that's I found it in Ljubljana, in Moderator, and other places where I moved around in Slovenia, that there's increasing number of these water fountains. And personally, I very, very rarely buy water outside. Say the gas station if I'm on a long trip. But even that's the rare case.
Everyone, experience just a few weeks ago, I was visiting Finland for some congress, and it was interesting that at the Airbnb I was there. The Lord told me, don't be scared about the water. Water here in Finland is drinkable everywhere. It's so crystal clear. And then they went to the conference where there was like 6,000 people, and at the end of the presentation, the organizer stated, you can drink the water in Finland wherever you want. It's definitely completely okay. So, and then I thought, okay, they are doing promotion to their water, and in Finland, of course, in Slovenia, I don't know, in any conference, we stated this scientific conferences which I'm attending, that water in Slovenia is also from the water completely fine. So we need to also have this in mind, that we need to be like a proud and not only to do something in order to have native water, but also to be proud of it, that we have high quality water as well.
I think it certainly is, at least in the last couple of years, the awareness of the quality of the water has increased, in my view, in Slovenia, indeed, and something we've carried out into the world as well through water diplomas and so forth. But like I said before, it's quick fake things for granted. So maybe that's why we're not communicating it in a way that is water is safe to drink, because it's common sense. Water is safe to drink, but it's not the case elsewhere in the world. Any other questions?
Perhaps our online panelists, anything else to add? What is in your experiences traveling around the world and being, let's say, made aware of the quality of the water there? Do you have any good or bad examples of communication that seems to be the key message?
My experience is that I'm happy to regularly find places when I traveled and pull up so much. I stay in Europe when I go, of course, to Croatia or Slovenia or to Brussels or to Germany, regularly I can drink the water. Sometimes I ask where I live, if this is possible, the questions, the answer was yes. So I agree with what P says that we should be happy about possibility to drink water. And I'm just currently also drink my hair water here, and it's in a bottle, but it's not something that I buy in the supermarket, just to the clear part there. And when we talk about risks, I don't know about today misunderstood this what said it before. I think risk is also a bit about numbers. Even when we talk about things that we do not know, it always can say that that water doesn't have the risk. If there would be a risk, drinking water somewhere in Austria, in Finland, on Slovenia, it's a very, very low basis risk, about 1 to 100,000 or 1 to a million chance to get some very big defect. If there would be a chemical, then we would think about these kind of chronic toxicity effects that do not regularly happen unless that we see with water that is contaminated with microbiological bacteria. So they are happy to have good water in Europe, and I think we have to work that this will still be the case of the future.
I want to share with you some clarification regarding to water. If we address the pollution in water, we can split it into 3 big groups: organic, inorganic, and microorganism. Okay, when you the long-term affection of the health, you are not going to see or relate to the trial. The problem is Escherichia coli, Salmonella, Rotavirus, Enterovirus. This is the part in which you have to be aware when you travel abroad. This is the case of Brazil, for instance, India, and other countries, which we know in advance that our body is not ready to accept this kind of water. We have to be careful. But that's it.
I think we have another question for James.
Yes, not the question is maybe a remark. The one is in the drinking water quality. We should do it because we have a European drinking water directive, and we all have to abide and do that. And so the water should be drinkable and good. And there's a risk that some poisons in the water are so new that we don't know them, that we didn't regulate them. Okay, we had this risk, but it should be good. Some of these chemicals have another meaning. We are quite centralized to our health. That's okay. But most of these chemicals are working also in the nature, in the ecosystem. And this is a widespread misunderstanding that our regulations, our limits for human health are the end of possible regulations. I had it very often, and that you have lower values for the nature than for drinking water. And it's clear, take a fish is living in water, and for a fish or the ecosystem, it's much harder. Pollution are there. So we have to think for us. We have to think for the drinking water for ourselves, the human centralized thinking. But we have to think also about the ecosystem, and the ecosystem is our second skin. So everything comes back when the fishes are ill, or when the animals in the water are in. So I think this is another reason that we should be very careful with these chemicals. more careful than we have been in the past. And this is a question not only to policy, but also to the responsibility of the chemical industry. What do we see? We have one problem with the chemical stuff. We see it, we start to forbid it or to regulate it, and the industry comes out with the new stuff. They put one carbon group to that or put it away, whatever, and then we wait 4 years and then we measure it again. And we say, hey people, that's the alternative, and then the next. And we do this since years and years, and I think we should change that. So we meet a more experience with this chemistry, we have to know them better, and especially the fluoride chemistry, the flow chemistry. Fascinating stuff is but unruinable. They live forever. And so this was a remark. One is a good drinking water quality is extremely important for understanding and for us, but water protection it's much more.
Matters. I think we're just about good on time. So if that is the last question, last comment, I would like to thank all the panelists here and online as well. I think we've heard a lot about risk today, like risk communication, and I think you should keep in mind that the solutions start at home with each of us individually, and then also at the same time hold different stakeholders, whether that's water utility companies, whether that's chemical industries, whether that's politicians, accountable for protecting whether it's water resources and reducing the risk of pollutants impact, having an impact on our health, not just our health, our children's, on their children's. So thank you again. Please carry these messages onwards to your friends and families and wherever the road takes you. Thank you.